I'm Dr. Mercola, and I'm a family physician, and for about the last 35 years or so. And I ventured off of that to start Mercola.com, which is the most visited natural health site for the last 15 years in the world. We have millions and millions of people coming every month. I mean, we have like 15 million unique visitors every month. So we have a large penetration throughout the world, helping people understand the foundational causes of disease, telling them about the dangers of the conventional approaches, and warn them about those so that they can consider strategies to treat the foundational cause of the disease. All right, well, I'm at SOPMed conference, which is one of the leaders in teaching ozone therapy to clinicians. And I've known about ozone for a long while. I'm friends with Robert Rowan, who's another leader, been doing it for many decades actually, and teaches it also. And it's a powerful intervention. And you would think, wow, because ozone, it's a reactive molecule. It's like going to create free radicals. Well, yes, it does, but so does exercise. And it can be very therapeutic. And interestingly, I'm not sure, I'm not an expert at it, but I don't believe anyone knows the exact mechanisms, but anecdotally there's just magnificent improvement with it. And it's probably functions similar to exercise. It's an oxidative stress, and then your body reacts to that. It's not high enough to cause serious damage. I mean, you can overdose it, and certainly you don't want to breathe this. Ozone's natural, it's in the atmosphere, and so it's not a brand new. If you have any odors, boy, it is great. I mean, there's nothing better at cleaning up odors than ozone, because it just breaks down all the molecules that cause the smell. But therapeutically and for your health, if you have serious health challenges, of course you want to see a clinician that addresses the foundational diet, the basics, the dietary interventions, the sleep, toxin exposures, emotional stressors. So all those has to be put together, and then when you add ozone on top of that, it could be a very powerful intervention. So there's different types of ozone therapy. I personally use the rectal insufflation, have for a number of years now, and was mistaken under the idea that you had to retain that gas for a few minutes. It's very difficult to do, so I became disenchanted with it. But now, by coming to the conference, I understood that you only need to hold it for 10, 15, 20, 30 seconds, and that's all it's required, and you're going to get the benefits. So now I'm excited and probably going to be doing it regularly. You don't, like any intervention, you don't want to necessarily do it every day. Exercise is great for you, but if you exercise every day, you're going to put yourself into a pit, and that's going to be problematic. So you want to have your body recover. But other than that, it's a very effective intervention. So if you're sick, then you're going to likely benefit from a visit to a clinician who's trained in this. It can do more aggressive ozone interventions and actually combine it with adjunctive therapies like ultraviolet light that can really be infused essentially into your red blood cells, and along with ozone. And they have even newer versions of ozones where they can give very high doses. It's called high dose ozone. They can put like 70,000 micrograms or even higher into your body along with the ultraviolet light. So there's been remarkable recoveries for many people. And the beautiful thing about this, I mean, there's a cost to it, of course, but it seems to be safe. So you're not going to damage yourself by doing it. It may not work, but at least you're not going to get hurt, like the side effects of many medications and certainly surgeries. And anytime you do a surgery, you got to remember in your head, it's irreversible. You cannot reverse the surgery. Drugs can be reversed somewhat, some of them, unless they kill you, of course, which happens to many people, unfortunately. It is a major cause of death in the United States, dying from taking legally prescribed drugs at the right dose. So just be careful, because these drugs, like, hardly ever, and absolutes are rarely correct, but this is close to an absolute. Drugs will rarely ever treat the foundational cause. But ozone can be a really powerful intervention, something you may want to consider. And not just for disease, it could be for health promotion too, and longevity, to help your body optimize the systems to combat all the stressors that we're exposed to in the 21st century. So hopefully something you'll consider.